Turning to a headline that's getting a lot of attention. It's been nearly 2 months since Friends star Matthew Perry died. There's an autopsy report from the LA County coroner, and it has concluded acute effects of ketamine as the main cause, ruling his death an accident.
And Dr. Darien is joining us now with the latest on this story. So what did we learn in the autopsy?
Yeah, well, these reports are incredibly detailed, and what we understand from them is what the cause of death is, what caused the death, and then the manner of death, or how it happened. And so from this report, we understand that an extremely high level of ketamine was found within his system, which was likely associated with his deep sedation and led to his eventual death. It's important to understand when you're talking about ketamine, it has a long history, been used for decades clinically, and has been shown to show some incredible benefits. I use it clinically in the hospital for treatment of pain. It's used in operating rooms to deeply sedate patients, and it's even a part of growing research that shows incredible advancements for treatment-resistant depression. But it does come with its risks. Ketamine can alter your vital signs in terms of your blood pressure and your heart rate, and it can even dangerously decrease your respiratory rate or your breathing, and even stop breathing, which is why it has to be used under the direction of a medical provider who is trained using it.
On this show, we've covered the ketamine being used for the treatment-resistant depression, and the thing that they always tell us at those clinics is this is so safe. That's so safe that they use it as anesthesia in children. So at what point does this become lethal?
You know, that's a good question. When you're using it clinically, it's often under a monitored cardiac setting. For example, if I'm using it in the hospital for a child to do something like a procedural sedation where you want to sedate them to avoid pain during the procedure, that child is hooked up to a monitor. We're monitoring their vital signs, and then also we're making sure that they're coming out of that medication and metabolizing it appropriately. Now, when someone is using it outside of a prescription, or if someone is using it recreationally, you just simply don't know what dose or potency you're getting, and that can open you up to a world of risk, which you're just not aware of.
So should we be concerned right now?
You know, I think it's a reminder of the fact that ketamine is a controlled substance for a reason. It's a reminder that it has to be prescribed and done with coordination with a medical professional. But I do think that we shouldn't step away from the advancements that we've seen with ketamine. We should just pay closer attention and making sure that we're being safe with it.
All right, Dr. Darien, thank you very much. We appreciate it.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.